Assalamu alaikum. I'm Professor Dr. Haidar Jawad Mubarak. I will present the second lecture in the topic of anatomy of the thorax. The first lecture was considering osteology of the thoracic cage, and this second lecture will complete the topic of thoracic cage and including parameters or descriptions to the thoracic walls. First, we have to say that the thoracic cage, as it is shown in the figure, in this figure, the thoracic cage shows an upper narrow opening and a wide lower opening. The upper opening is sometimes called as the inlet of the thorax, while the lower wide opening is called the outlet of the thorax. And also this figure shows that the transverse section of the thoracic cage appears kidney shaped, and this is very important feature because this appearance of the transverse section of the thoracic cage could be seen in CT scan or MRI that are commonly used in a clinical practice today. You can see here that the transverse diameter of the thoracic cage in a transverse section is longer than the anterior-posterior diameter. And this normal appearance usually is disturbed in smokers. The smokers have a long anterior-posterior diameter or a wide anterior-posterior diameter, just like the transverse diameter, and thus the smoker's chest is usually called barrel chest because of the longer anterior-posterior diameter. The superior opening, the narrow superior opening or the inlet of the thorax, is bounded anteriorly by the manubrium, posteriorly by the first thoracic vertebra, on the sides by the first rib. Usually this inlet is closed on the side by a triangular fascia, which is called Simpson's fascia, or sometimes it is called as suprapleural membrane, because deep to this fascia is the cervical pleura and the apex of the lung. Usually this fascia is crossed superficially or superiorly by the subclavian vessels, and the mid-region between the right and left suprapleural membrane is an empty or an opened region in which structures passing either from the neck into the thorax or exit from the thorax into the neck. While the wide outlet, the inferior opening of the thoracic cage, as it is diagrammatically represented in this figure, is usually bounded anteriorly by the infrasternal angle, which is called also substernal angle anteriorly, and bounded by T12 vertebra posteriorly, while on the sides the inferior wide opening of the thoracic cage is bounded by the so-called costal margin. And the term costal margin usually refers to the 7, 8, 9, and 10 costal cartilage. Whenever you will hear the term costal margin, you should remember that this term, costal margin, indicates 7, 8, 9, 10 costal cartilages that are articulating with each other. And therefore, the costal margins on the sides, the infrasternal angle anteriorly and T12 vertebra posteriorly, form the boundaries of the outlet of the thorax, which is the inferior wide opening of the thoracic cage. Of course, this inferior opening of the thoracic cage is closed by the diaphragm. The muscles, in addition to bones of the thoracic cage, form the thoracic walls. And so in the next few slides we will describe what forms the thoracic walls in terms of muscles and vessels and nerves. Primarily, we have to say that the thoracic wall is formed from superficial to deep by skin, then superficial fascia, which is rather fatty in the thorax, and then thin deep fascia, then extrinsic muscles of the thoracic wall. These muscles are muscles of the upper limb, just like pectoralis major and minor, serratus anterior, latissimus dorsi, and muscles of the abdomen like rectus abdominis and the oblique muscles, and even muscles of the back. All these muscles of the upper limb, of the abdomen, and of the back represent extrinsic muscles of the thoracic wall. And deep to these extrinsic muscles, you can see the ribs, and in between the ribs are the intercostal muscles, which are therefore could be described as intrinsic muscles of the thoracic wall. And more deep to the ribs and intercostal muscles is a thin fascia, which is called endothoracic fascia, and then you will have a membrane, just like a nylon membrane, which is called pleura, that will be considered later on. So, as we said, the spaces between the ribs is filled with intercostal muscles, and these spaces are called intercostal spaces, and actually there are 11 intercostal spaces. All of these 11 intercostal spaces contains, as we said, intercostal muscles in form of 3 layers of intercostal muscles. The first layer, which is the most superficial, is called external intercostal, and then deep to this is the internal intercostal muscle, and then the deepest is the innermost intercostal muscle. And as we said, these muscles are lined by endothoracic fascia, which is lined from inside by the pleura, the membrane of pleura. You can see we have 12 ribs, but we have 11 spaces, because the space below the 12 rib is a subcostal space. It is not an intercostal space. All these intercostal muscles are supplied by nerves, which are called intercostal nerves, which are the thoracic nerves from number 1 to 11, as you know. Again, T12 nerve is not intercostal, it is subcostal nerve. And therefore we will consider anatomy of the intrinsic muscles of the thoracic wall, which are the external intercostal muscle, internal intercostal muscle, and the innermost intercostal muscle. Starting with the external intercostal muscle, you can see that these muscles have fibers that are directed downward, forward, and medially, and they are attached to the lower border of the rib above and inserted into the upper border of the rib below. These external intercostal muscles, as is shown in the figure, extends anteriorly to the level of the costochondral junction, the joint of the rib with the costal cartilage, because more anteriorly between the costochondral junction and the sternum, the intercostal space does not contain external intercostal muscle. Here the external intercostal muscle is replaced by a membrane. You can see the muscle, the flesh muscle, stops there, and more medially the muscles, are the external intercostal muscles, are replaced by a membrane, which is called external intercostal membrane, or could be termed as anterior intercostal membrane. External intercostal membrane or anterior intercostal membrane. While posteriorly the external intercostal muscles extends back to the tubercles of the rib. You know the tubercles of the rib. The internal intercostal muscle, of course, lies deep to external. This is the external. This is the internal intercostal muscles. The internal intercostal have a muscle fibers that are directed on right angle to the direction of muscles of the external intercostal. The internal intercostal muscles are the fibers are directed backward, downward, and laterally. And the internal intercostal muscles extends anteriorly to reach the borders of the sternum, but posteriorly they are extending just to the angle of the rib. You know, the shaft of the rib shows an angle posteriorly, and the angle of the rib represents the posterior limit of the internal intercostal muscle. More medial to the angle of the rib, as it is shown in this figure, the muscle, the internal intercostal muscle, is also replaced by a membrane, which is called internal intercostal membrane, or it could be termed as posterior intercostal membrane. Finally, we have to talk about the innermost intercostal muscle. You know, innermost intercostal muscle have a muscle fiber directed just like the internal intercostal muscle, downward, backward, and laterally. But the innermost intercostal muscle are extending only in the lateral 2/4 of the thoracic cage. The anterior 1/4 and the posterior 1/4 of the thoracic cage do not contain innermost intercostal muscles. This innermost extends only in the lateral 2/4 of the intercostal spaces, or in the thoracic cage or thoracic wall. And you can see that the internal intercostal muscle has another name, a synonym, which is Intercostalis intimi. And here we have to say that some textbooks consider a family called muscles of transversus thoracis, or transversus thoracis muscles. And some textbooks consider that Intercostalis intimi, which is the innermost intercostal, as one part of the group which is called transversus thoracis muscle. And in addition to this muscle, the intercostalis intimi, or innermost intercostalis, the transversus thoracis group of muscle contains also subcostalis and sternocostalis. Subcostalis is demonstrated in this figure. Subcostalis are a group of strap-like muscles, and they are lying on the sides of the vertebrae, on both sides of the vertebrae. This region is called paravertebral gutter. You can see that these strips or straps of muscle fiber attached to the inner aspect of the ribs, just like the innermost and the other. And the subcostalis are most usual, have a most usual appearance that the subcostal strip crosses more than one intercostal space. It is not usual to cross one space. Commonly, subcostalis muscle strips cross more than one space. So subcostalis is also considered as a group of transversus thoracis muscle, in addition to intercostalis intimi, or the innermost. Also, behind the sternum you have muscle fiber which is called intercostales, because these strips of muscle fibers attach to the back of the sternum and to the costal cartilage from second to sixth, and so they are called sternocostales, and that represent also the third part of the transversus thoracis group of muscles. So some textbooks considered a group which is called transversus thoracis muscle include sternocostales, subcostales, and innermost intercostal muscles. Well, other textbook refers to sternocostales as the only muscle which could be termed as a transversus thoracis. We will consider, according to the textbook that we are depending on it, that the innermost, subcostales, and sternocostales are part of the big family transversus thoracis. What's remaining in the topic of the thoracic walls, in addition to the muscles, are the nerves and vessels of the thoracic wall. And I think you remember that the lower border of the ribs from inside shows a costal groove. And this costal groove from the inside of the lower border of the ribs contain intercostal nerve, intercostal artery, and intercostal vein that are arranged from inferior to superior as nerve, artery, vein, referred sometimes as vein arrangement, vein, artery, and nerve. These intercostal nerves, veins, and artery runs in the space between the innermost intercostal and internal intercostal, and I think this figure shows this description accurately. You can see the vein, intercostal vein, artery, nerve, so it is vein. These intercostal nerve, vein, and artery run in the costal groove in between the internal intercostal and innermost intercostal, and thus this region where the vein arrangement is running is called the neurovascular region or neurovascular plane between internal intercostal and innermost intercostal. So in order to describe the nerves, the veins, and the artery, we will start with the nerves. Actually, the intercostal nerves have a certain classification into typical and atypical intercostal nerves. And you can imagine that we have 11 intercostal nerves, which are the thoracic nerves from T1 till T11, because T12 is not an intercostal nerve, it is subcostal nerve. So among these intercostal nerves, T4, 5, and 6 are called typical intercostal nerves, because these nerves supplies only the thoracic wall. Others are atypical because they are supplying the thoracic wall and supplying other regions. For example, T1, 2, and 3 are atypical intercostal nerves because they are supplying the upper limb. They are sharing in supply of the upper limb. So, because they are supplying the thoracic wall and the upper limb, T1, 2, and 3 are atypical thoracic nerve, atypical intercostal nerves. And also, T7, 8, 9, 10, and 11 are atypical because T7 till T12 supply the anterior abdominal wall in addition to supplying the thoracic wall, and thus they are atypical. So the only remaining are T4, 5, and 6 are typical intercostal nerves because they only supply the thoracic wall. What about the intercostal arteries? Actually, the neurovascular plane between the innermost intercostal and internal intercostal shows one posterior intercostal artery in each space and two anterior intercostal arteries in each space. Regarding the posterior intercostal arteries, you can imagine that the single posterior intercostal arteries originates as following. The first and second posterior intercostal arteries on the right and left side originates from the subclavian artery. And I think you remember that the subclavian artery continues at the outer border of the first rib, forming the axillary artery. So this subclavian artery on right and left side gives a trunk which is called costocervical trunk, and this costocervical trunk gives a branch which is called superior intercostal branch, and the superior intercostal branch gives the first and second posterior intercostal arteries to the first intercostal space and second intercostal space, while the posterior intercostal arteries of the third space, fourth space, till the 11th space, and even the subcostal artery, which is running deep to the 12th rib, all the posterior intercostal arteries from the third down to the 11th are branches of the descending thoracic aorta. What about the origin of the anterior intercostal arteries? As we said, each of the intercostal spaces shows two anterior intercostal arteries, and you can see that the upper anterior runs at the lower border of the rib above, and the lower anterior run or originates at the lower border of the at the upper border of the ribs below. The upper is at the lower border of the rib above, while the lower is the upper border of the rib below. The anterior, the paired anterior intercostal arteries originates from these two arteries that are running vertically downwards on the sides of the sternum. This is the sternum from behind, and these are the costal cartilage, and you can see that from inside of the thoracic cage you can see a large parallel pair of arteries that are called internal thoracic arteries. These internal thoracic arteries are branches from the subclavian artery again, and the bilateral internal thoracic arteries gives two anterior intercostal arteries in each space. And you can see that at the sixth intercostal space, the internal thoracic artery bifurcates. The internal thoracic artery bifurcates into the so-called musculophrenic artery and superior epigastric artery. The superior epigastric artery descends down to supply the anterior abdominal wall, while the musculophrenic artery runs behind the costal cartilages of the costal margin, giving 2 anterior intercostal arteries for the 7th space, 8th space, and then 9th space. The anterior intercostal arteries, the pair of anterior intercostal artery and the 9th space represent bifurcation or termination of musculophrenic. And you don't have anterior intercostal artery in the 10th space or even into the 11th space. Therefore, the anterior intercostal arteries are branches of the internal thoracic arteries from the 1st space down to the 6th space, while the 8th space, the 7th space, the 8th space, and the 9th space have anterior intercostal branches from the musculophrenic, not from the internal thoracic. And the 10th space and 11th space do not have anterior intercostal arteries. Let us see this feature in consideration to the vein arrangement, the nerve, vein, and artery. Just look to this figure that shows the posterior 1/4 of the thoracic wall, and that figure that shows the anterior 1/4 of the thoracic cage or thoracic wall. Before a while we said that the innermost intercostal is located only in the lateral 2/4 of the intercostal spaces. And so the posterior 1/4 and the anterior 1/4 do not have innermost intercostal. So if you are looking to the vein arrangement in the lateral 2/4 of the thoracic wall, you can see that the vein arrangement lie in between the innermost intercostal muscle and the internal intercostal muscle. These veins are running in the neurovascular plane. While if you are going posteriorly in the posterior 1/4 of the thoracic wall, there is no innermost intercostal muscle. So from inside you can see the vein arrangement uncovered. Laterally the vein could not be seen because it is covered by the innermost, while posteriorly the vein could be seen from inside, because here there is no innermost intercostal muscle to cover it from inside. And deep to this vein muscle is the internal intercostal membrane, which is also called posterior intercostal membrane, which is replacing the internal intercostal muscle. You know, the internal intercostal stops to the angle of the rib, and beyond the angle it is replaced by a membrane which is called internal intercostal membrane or posterior intercostal membrane. So in the posterior 1/4 you can see the vein uncovered from inside by innermost, and deep to the vein this whitish colored region is the internal intercostal membrane, or it could be called as posterior intercostal membrane. Of course, such a configuration is also seen anteriorly in the anterior 1/4 of the thoracic wall, because here also there is no innermost intercostal muscle, and so you can see the vein arrangement from inside of the thoracic wall. You can see it that deep to this vein is the internal intercostal muscle, because you know the internal intercostal muscle extends to the border of the sternum. This is the sternum, and next to the border of the sternum this is internal intercostal muscle deep to the vein. Of course, during dissection you'll not be able to see the vein whether in the posterior 1/4 or in the anterior 1/4 of the inside of the thoracic wall, unless you remove the pleura, and then you have to remove the endothoracic fascia. Before passing to the topic of the vein, the intercostal veins, you know, we had discussed the intercostal arteries and then intercostal, and before the intercostal nerves, and we have to pass into the intercostal veins. But before we would discuss the description to the anatomy of the intercostal veins, let us say something about the internal thoracic arteries. The internal thoracic arteries, just like I described before a while, are branches from the subclavian arteries bilaterally running from inside of the costal cartilages on the sides of the sternum, and they give anterior intercostal arteries as a pair in each intercostal space down to the 6th intercostal space. At the 6th intercostal space, the internal thoracic artery bifurcate into two terminal branches, which are musculophrenic and superior epigastric. The superior epigastric supplies the anterior abdominal wall, while the musculophrenic artery gives a pair of anterior intercostal arteries for the 7th space, 8th space, and the 9th space. In addition to the anterior intercostal arteries, the internal thoracic arteries on the sides giving the following branches: pericardiophrentic artery supplying the pericardium and pleura and diaphragm, and also the internal thoracic artery gives perforating branches perforating the chest wall to supply the breast, especially in female, and also these internal thoracic arteries gives mediastinal branches to the mediastinal structure. Just look to the abbreviation here for the name of the internal thoracic artery. It is called right internal mammary gland and left internal mammary gland, because branches from the internal thoracic artery supply the breast, the mammary gland. So sometimes, because it is so significantly supplying the breast, it may be termed as internal mammary artery rather than internal thoracic artery. So we have to say now something about the intercostal veins. As you remember, the arteries, the intercostal arteries, are one posterior and two anterior, and also remember that the anterior intercostal arteries are absent in the 10th space and 11th space. So similar pattern will be seen in the description of the intercostal veins. Again, you have anterior intercostal veins and posterior intercostal veins. The anterior intercostal veins are two in each intercostal space, and you don't have anterior intercostal veins in the 10th and 11th space. So the anterior intercostal veins of the 9th space, 8th space, and 7th space unite with each other to form the musculophrenic vein. The musculophrenic vein unite with the superior epigastric vein, draining the anterior abdominal wall, and this union occurs in the 6th intercostal space to form the internal thoracic vein. The internal thoracic vein ascends up behind the costal cartilages on the sides of the sternum, receiving two anterior intercostal veins from each space, and then the bilateral internal thoracic veins ends into the brachiocephalic veins. The posterior intercostal veins have rather a peculiar description. Again, the posterior intercostal veins are single vein for each space. The first posterior intercostal vein is tributary of brachiocephalic vein on the right and left side, while the second, third and fourth posterior intercostal veins, second, third, and fourth, unite to form the superior intercostal vein, both on the left and on the right. Here you can see the second posterior, third posterior, and fourth posterior intercostal vein unite to form left superior intercostal vein, and this is the right superior intercostal vein. The right superior intercostal vein ends as a tributary in the azygos vein, while the left superior intercostal vein is a tributary of the brachiocephalic vein. The fifth posterior intercostal vein on the right side, and the seventh, the fifth, sixth, seventh, eighth, and down to the 11th posterior intercostal vein. Posterior intercostal vein from 5 to 11 are tributaries into the azygos vein on the right side, while the 5, 6, 7, 8 posterior intercostal veins on the left side are tributaries of the accessory hemiazygos vein, while the 9, 10, to 11 posterior intercostal veins form the hemiazygos vein. You can see that the accessory hemiazygos and the hemiazygos cross the vertebrae to be a tributary of the azygos vein. The accessory hemiazygos crosses at the level of T8 vertebra, while the hemiazygos crosses at the level of T9 vertebra. And you can imagine that the origin of the azygos vein is into the abdomen below the diaphragm, and it is formed by union of the T12 subcostal vein with the lumbar veins, just like the origin of the hemiazygos. And you can see that the azygos ends superiorly as a tributary of the superior vena cava. Finally, we have to say something about clinical anatomy of the intercostal spaces. Sometimes, just like in chest infection, cancer, tuberculosis, fluid will be collected inside the chest in the pleural cavity. And this fluid is called pleural effusion. It will push the lung, and so the patient will not be able to expand his lung, and thus he will feel difficulty in breathing or shortness of breathing. And so you have to aspirate this fluid by inserting a needle through the intercostal space to get this fluid out. So the clinical importance of anatomy in the basic of aspiration of fluid from the thorax, pleural effusion, is summarized in 2 points regarding the site of insertion of a needle into the intercostal space to aspirate pleural fluid from the chest. First, you have to insert the needle at the upper border of the rib below, because here you don't have vein. It's not of benefit, or maybe it is dangerous, to insert the needle at the lower border of the rib above of the intercostal space, because insertion of needle in this region may injure the vein arrangement. This is number one. Number two, you have to insert the needle in the mid-axillary line lateral to the angle of the rib. This is because the van arrangement medial to the angle of the rib run obliquely into the intercostal space, and when you will insert the needle medial to the angle of the rib, you may injure the obliquely running van arrangement. Of course, the clinician have to percuss the thoracic wall by his fingers, and he will percuss from below upward till feeling the upper level of the fluid, and then he will go 2 centimeters below this level and inserting the needle in the mid-axillary line at the upper border of the rib below. That's all about anatomy of the thoracic walls. Thank you for listening.